My name is Dr. Priska Mosol from Moi University in Kenya. And I want to welcome everyone to join us in this needs assessment dissemination webinar. And presenting today is our co-lead, our lead for the East African region, Dr. Roy Gonzaga Mubuke, who is a senior lecturer in the Department of Radiology at Makerere University. And so we will give him some minutes to give the presentation. And then we will have some time for interaction. I know that this is a topic that is of interest to most of us. And so we really want to invite your contribution, because at the end of the presentation, we really want to come up with strategies or recommendations that can help us to come up with strategies. So members, allow me to invite Dr. Roy. And before that, also I want to really thank the AfriHealth Secretariat for giving us this opportunity to present these findings, which were done across the 10 countries in the Eastern African region, and we shall be seeing the representation in the presentation. So welcome, Dr. Roy. The floor is yours to take us through this dissemination report. Thank you and welcome. Dr. Roy, you can go ahead.
Thank you very much, Priska. I hope you can hear me.
Yes, you're clear.
Priska, can you hear me?
Yes, you are loud and clear on my end.
Am I audible enough?
Yes.
Am I audible enough? I want to proceed.
Yes, you are, Dr. Roy.
Okay, I'll switch off my video to increase the bandwidth. So thank you very much, colleagues from the Eastern African region. You are welcome. Yes, Roger. Okay, so colleagues, you're welcome to this dissemination webinar, and would like to share with you our findings from a short needs assessment survey that we made with a focus on identifying training gaps in health professions education. I used two, but these two are used education to encompass all the health professions. To discuss and come out with some strategies that will help us to address these training gaps. So we shall be inviting you to interact, to give opinions, and most of the webinar part is actually meant for us to interact. Let me just go to my next slide. So a brief of the context and background that anchored this needs assessment survey. Most of us are involved in teaching. We are faculty, we are clinical educators in our different institutions and training different health professionals. So, as you agree with me, majority of us just find ourselves in the deep end, okay? We are not formally trained as teachers, as professional teachers, but we find ourselves in teaching situations, majorly because of your excellence academically or your clinical expertise or research expertise. Then you are recruited to teach the future health professionals. But we are not professional teachers, and we lack educational expertise in certain areas. And usually junior faculty in institutions learn on job, okay? We learn pedagogy, we learn teaching and learning, we on job really, okay? And we don't have formal mentorship programs for that. At the same time, there are limited opportunities to hone our skills as educators, specifically in health professions education. You may have a variety of opportunities in your area of expertise, professional area, but there are limited skills in HPE, limited opportunities for us to build capacity, okay? Programs are more on our clinical disciplines and less on health professions education to make us better teachers. So that's the context we operate in our region. And thus this brings a problem because as faculty, we find ourselves in teaching, but we are not professional teachers, and yet we have limited opportunities to build our capacity to become better educators, okay? And as such, health professionals who find themselves as teachers in institutions struggle to effectively transfer knowledge and skills to their learners, as well as assess their learners effectively. You may be a good clinician, but not a good teacher. So the skills and knowledge you need to transfer that clinical expertise you have to somebody else must be honed, but we don't have that opportunity. And also there are new trends that keep coming up globally in the training of health professionals, teaching skills, assessment skills, curriculum development. There are always new things coming up. And this is always a challenge to many of us because you are not capacitated in this area of HPE. Therefore, we find a challenge taking up those trends, okay? And therefore, as a result, we end up with poorly trained and assessed students, and we make unreliable decisions in the process of teaching and learning, which negatively impacts the competency of our graduating health professionals. And therefore, because of this, we thought we need to take a snapshot of what are the key training gaps for us as faculty in the region, with the justification of trying to come up with targeted training interventions. It may not be very long programs, advanced programs like master's degrees in health professions education, but even short faculty development workshops can be a good starting point. But this can only be, leveraged when we identify the key training gaps. And therefore, this will help us to strengthen our capacity as teachers, as educators, to teach our students, to improve the quality of teaching, and therefore improve the competence of our graduating health professionals. So we envisaged a theory of change. We think if you train, if you build capacity of a critical mass of educators with key skills in health professions education, with key skills in teaching and learning, and all aspects that are concerned with HPE, we can build that critical mass of faculty who are skilled to handle students, to handle curricular issues, to handle assessment issues, and therefore this can be used as the change agents in the various institutions to concretize the presence of health professions education in these institutions, to contribute to the improved training of our students, and therefore competency of our graduates, who will in the end work on our populations in the community to improve their health. So that's a theory of change that we envisage when we try to identify these training gaps, and then we try to capacitate faculty with some key skills in HPE. The purpose of this short survey was to identify basically gaps in knowledge and skills, focusing on health professions education that can eventually inform targeted training in certain areas, because you can't start with everything. The field of HPE is so wide, so we can start somewhere, wanted to start somewhere, and then eventually grow as we move on. We designed a short survey. It was cross-sectional and targeting faculty in teaching institutions in the region. A number of you received requests to complete the survey. We targeted basically everybody, so we didn't have to sample because we wanted as many respondents as possible. And we used a short online questionnaire, which has its challenge with getting completed, but we tried to distribute it using the various platforms that we have. It was self-administered, and then we distributed to our colleagues, and we got some good responses. Oh, in the end, we got 72 responses from 72 people, which is quite good. If you've done online surveys and so on, this is quite good. Sometimes you send out a survey and you get only 10, but we got 72 responses, which on our end was quite good. And the major outcome of the survey, as we are going to see, we came up with, after looking at the data and what people responded to, we came up with 10 key priority training themes that were identified where we need to begin and form targeted training interventions. The responses, when we talk about the Eastern African region, we are talking about the greater Eastern African region. So the responses were received from those countries, as you see. Of course, there are more from some than others, but at least we tried to, when you look at this, the 72 were distributed. At least we got a response from the greater, from a number of countries to represent the region. And I don't have that table here, but we got also responses from different health professions. Definitely the doctors were the majority, about 60%, and then nurses, which is not surprising. Maybe they are the biggest, they have the biggest numbers, but then we got representation from even the other allied health professions. So we're happy with the responses. These are the 10 key priority training gaps that were identified. I'm not going to go through the descriptions of each, but these were the 10. Competence-based medical education came out very prominently. Many people are claiming to be doing competence-based medical education, but they are not. Okay, so there is still some confusion. And some people are like, okay, for us who didn't train, who people claim we use the traditional training, aren't we competent? So it's still a gray area that we need to emphasize. What does it mean? How do we transition into competence-based medical education, which even WHO is now advocating for? Then the second training area was curriculum design and development. Many people find themselves, many of us, being told to design curricula, to review curricula, but we don't know how to start. So this is still a problem. How do you design a curriculum, a new curriculum? How do you go about reviewing an existing curriculum? And what is involved? And many of us are involved in that. But we need more honing of skills on how to do it effectively. Student assessment, it's not a surprise. This coming up, it's always an issue. We have issues with assessment. We have new assessment methods coming up in medical education, but people are slow to adopt them because they don't understand them. Some of them are applicable here, others are not. So we need a whole retraining in student assessment and to embrace new assessment methods, and also willingly discard of the old assessment methods that were used to. But unless you train and you know what these methods are, the advantages and disadvantages, and I can give an example. There is one person who said that they're being told they should discard, they should do away with the long case. Those who have assessed clinical students, long case, because it's obsolete. And this person was seeing no way, there is no way you can do away with a long case, okay? But there is literature in medical education that actually a long case no longer works. But unless we go through some of these trainings, we cannot appreciate them. Educational research and manuscript writing also featured prominently where people need training. Many of us health professionals are very competent in our clinical research, but the whole game of educational research is a bit different. You need to shift your mind and your thinking to embrace a new research paradigm and new theories and so on. So it's something that many people don't understand. Even in our IRBs, when you submit educational research protocols, sometimes people don't understand. So this is an area that also featured prominently. Grant writing in health professions education. Recently, there are a number of grant funding opportunities that are put out there to improve teaching and learning, but we don't know how to respond to them. So it also came up as another area where people need skills in grant writing. Artificial intelligence and educational technologies, I think this is not a surprise. Following up on the COVID era, this has become the norm for all universities and higher institutions of learning. Unfortunately, most of our institutional leaders tell us to use education technologies, e-learning, online learning, AI, okay? But most of us are not trained in the use of these things, okay? It's more than PowerPoint, it's more than Zoom. So this was a very key area that we need to focus on, education technologies, and that's what involves e-learning, online learning, and also artificial intelligence in teaching and learning. And this is very important because AI has come to stay and we need to embrace it. But we need training in this. Very importantly, this came up, doctoral student supervision. It was quite surprising that people need actually training on how to supervise, and specifically doctoral students. So some supervisors don't know what to do. Even the students don't know the role of the supervisors, not knowing that doctoral supervision is actually a pedagogical process. It's not just putting track changes in somebody's manuscripts or chapters or giving feedback anyhow. It's more than that. It's a pedagogical process along which a person is supposed to learn certain skills. But it came out as another key area that needed emphasis and training people how to supervise doctoral students. If we extrapolate this and perhaps even master's students, many of us are not very good supervisors. We tend to supervise the way we are supervised, but sometimes it doesn't work that way. How to organize faculty development workshops also came up. How can you organize a faculty development workshop? Many of us just find ourselves in the deep end. They are told, organize a development workshop for faculty in this area, and we don't know how to start. What do you need? How do you start to organize it? How do you evaluate effectiveness of a successful faculty development workshop, and so on? Those are key areas that happen in our institutions that people need to be trained in how to deliver them effectively. Mentorship always keeps coming up. There are always different mentorship models, but I think we need to continue telling people how to do good mentorship, how to successfully be a good mentor, and how to, to institutionalize good mentorship practices. This is a topic which has always come up over and over in many settings. And then lastly was simulation-based learning. Simulation-based learning, we've read about it, we've heard about it, we want to do it, we don't know how to do it, especially in our resource-constrained environments. When we think about simulation, we think about high-fidelity models, high-fidelity technology, which we can't afford. But can we do actually simulation that is suited to our context? Okay, we can use low fidelity models to actually do simulation. But I think people felt they need some training in simulation-based learning, what it is, how do you do it, how can you implement it in a resource-constrained environment. So these are the 10 key areas, and I know there are more, but we need to start somewhere. These are the 10 key areas that we sieved out from most of the responses. They are more, but at least we can
Hello, Roy, we lost you at some point. We can't hear you.
And which we should tackle and find a way of addressing. What?
Hello, Roy, your microphone is breaking. You are breaking. We can't hear you.
Please, your microphone is not loudly. We need it to be loud. I'm not hearing you too.
Before I continue, Roger, can you hear me?
Yes, we can hear you, but we lost you at some point.
Yes, there was a break. So if you can touch on the point that you were speaking on so that it will come clearly.
I was talking about the key challenges that were identified. And one of them was the slow institutional recognition of health professions education as a distinct field in our institutions, with limited acknowledgement in faculty promotions and appraisals, as well as career advancement. And this is, I think, the biggest challenge that we are having in our region. If you look in Africa, I think apart from South Africa, where HPE has been really recognized as a field, we lack this in most of other regions in Africa. And when people get engaged in this kind of activities, the claim is that we are not promoted, we are not recognized, and so we tend to give it less attention. So this is a big challenge. In addition, most of our institutions don't have dedicated departments of medical education or health professions education, or even a unit, okay? So you find that it is scattered everywhere. There is nobody who is responsible for what. If it's curriculum development, you suffer with it, okay? You who wants to develop a program. There is no responsible office and everybody is in their own cocoon, their own discipline, okay? Plus also competing demands and workloads in the hospitals, teaching, and so on. So there is less time given to health professions education activities. And these are key challenges in our region, which we want together as a team to see how we can navigate through. We're thinking, having identified this and the challenges that exist, how do we move forward? And this is what we want to discuss about this afternoon. Having identified these gaps, how can we address them? At least to build some level of capacity among our people to become better and knowledgeable educators. The onus lies on the institutions to identify these training gaps and build capacity of their faculty. There are networks like AfriHealth that provide platforms to tackle some of these challenges. They have opportunities like webinars, collaborations, where faculty and members can develop their skills in some of these identified gaps that we came up with. Ultimately, we need our institutions to start departments of HPE in the universities or institutions. It's the departments that can drive faculty development in these areas through short courses, development workshops, and they can offer support in issues to do with curriculum development, student assessment. They offer support to the rest of the departments. And in universities where these departments are, they're doing quite well. In some of our regions, we are still yet there. We are not yet there. Then they need to recognize scholarship in medical education during faculty promotions and appraisals needs to be given more push. I know most of our institutions, are very hesitant to do this, but we need to give it a push. And one way forward is to encourage faculty to integrate educational research into their primary clinical disciplines. That could be one way of, pushing this agenda in our institutions. If you are a surgeon, you can do HPE related to surgery. How can you advance surgical training? How can you advance student assessment in surgery? How can you advance, simulation in the training of surgery? If you're a pediatrician, you remain within your field and then advance HPE related to your field. I think that's one way we can start to address some of these gaps. But I think the platform is now on us for us to discuss strategies, to share experiences, and how we can tackle these identified training gaps. This was my last slide. Thank you very much. Over to you.
Thank you. Thank you very much, Dr. Roy, for that very clear and elaborate presentation. So to the members now, I want to open the floor. You have had the recommendations, you have had the findings from the report. And so we really want your inputs so that we can come up with recommendations that can be used to come up with strategies. I think, as Roy put it very clearly, that we still have contextual challenges within the region, whereby you find that in most of the institutions, we do not even have units for health professions education. So we still have those kind of challenges which we have to acknowledge, and therefore we need these practical recommendations that can fit into our context. So let me see if there is anyone who is ready to take the floor to give the comments. And again, we appreciate, I have seen quite a number of comments in the chat from Stewart and others, and we really appreciate those comments given on the chat. So anybody, is there any hand? So the floor is open. You're free to react. You're free to give your input or your recommendation or anything that you feel can really help us as we look forward to coming up with the interventions on the same. Maybe from the chat, I can see from Stewart talking about...
Yes. There's a hand up.
Yes, Stewart, please go ahead, and thank you.
Well, hello, everyone, and I'm very delighted to be with you. I worked in faculty development and curriculum change for 20 years around the world, and particularly in Africa during the 90s, 80s and 90s. And the issues that you are presenting today are very similar to the ones that were present in the 80s and 90s. It's interesting. Although medical education has changed, the issues have not. One of the things I want to point out is how you are thinking about this. There is a big difference between training, which is a procedure and step by step and skills based, and education, which requires that people learn how to think and develop thinking among students so that they can deal with difficult problems and problems that don't have simple solutions. So there's a difference between developing for training and developing for education. And that was my first comment.
Thank you, Stewart. Dr. Roy, do you want to respond to that? Dr. Roy? Okay. I don't know if.
So I'm sorry,
Well,
Dr. Roy is trying to connect back, so I think we can take in more questions as
Okay,
that's connect
okay.
back. Yes.
Thank you. Yes,
I would like to add some other comments that
you can add, and then it will be responded to at once. Go ahead.
I don't think you should be training for assessment. You should be training for assessment of learning, not for assessment of competencies or things. You want to focus the concept of assessment on the learning, not on the technical aspects of assessment. You can get lost in the technical aspects of assessment and forget about learning. The whole idea of assessment is to determine if students are capable of progressing in their education. It's assessment of learning and ability. It's not assessment methods. You need assessment methods, but if you just think about methods, you end up with a mechanical system, not a learning-based system.
Thank you, Stuart. Let me see if Dr. Roy is in position to respond now.
Yes, I've rejoined. Sorry, I didn't get the question properly.
Do you want me to repeat?
Yes, please.
Yes.
There's two things I said. One is that when you do curriculum and development in a school for training, it's a procedure. It's step by step. It's like simulation. When you develop curriculum and for education, you are developing students' ability to think and understand context and community-based health and the social determinants of health. That's not a procedure. That's complex thinking. And you need to engage students in dialogue. Training is different. It's step by step, piece by piece. And if you confuse training and education, you destroy both.
Yes, thank you, Stuart, and happy to see you. Stuart was one of my faculty when I was a FEMA fellow. So I think that's more of a comment, and I agree, training and education, but also you mentioned something about critical thinking, which is
Yes.
which is very important, and in today's world, that's what our aim should be. We need to train students how to be critical thinkers. I totally agree with you. So as we look at this, we need to look into that direction and see how we can capacitate our teachers to actually transfer these skills to our learners and create educational moments and educational activities that actually foster the development of these skills. So thank you very much, Stuart.
Thank you, Roy. And I think he has also mentioned something very important about assessment, that the focus should actually be on assessment for learning as well as assessment for learning, and not really putting emphasis on the methods, I think, which is very clear. And looking at one of the needs, the one for competency-based education, I think a majority of the countries within the region, they are not yet fully into competency-based education. And I think once this is also rolled out in most of the institutions, that will really improve some of the learning methods under that CBME. So I think that's one of the other comments that Stuart talked about. I can also see Ian Cooper in the house. I don't know if he wants to say something, Professor Ian. He has mentioned something about assessment.
No, I don't have anything particular to add, thank you.
Welcome.
But I was just noting the fact that, just to challenge that we don't only assess, assessment shouldn't be only of what learning has happened, but for learning. In other words, how do we improve and promote learning through assessment.
Yeah. Ian, thank you. You're very right. And these days, that's why we put a lot of more emphasis on programmatic assessment. And like also Stuart emphasized, we need to promote more assessment for learning, because we are forming the students, and we need to adopt assessment strategies that actually promote learning. Thank you.
If I could make one more comment. Yeah, I want to make one more comment. In this assessment that you did of needs in the region, one of the questions that's really important is, how do teachers think learning works? What is the concept of learning that the teachers have? Because if you're going to ask them to participate, you need to know how they think about learning. If they think about learning as a replication, your efforts in faculty development will not work. And so faculty development has to also focus on having the dialogue of how learning works and how teachers think learning works, because it's the teachers that will implement your programs for students.
Yeah, exactly. I think we have noted that. That's one of the key things that we also need to focus on. How teachers, perceive the concept of learning and how actual learning happens. So we've noted that. We shall add it on to beef up these ideas.
Dr.
Yes.
Roy, thank you. I would wish to amplify that comment of how teachers think learning works. I'll bring an example of an institution that Dr. Roy will be in. That's the Makerere University. Over time, students have been given feedback forms to assess the learning process. But the translation of this feedback into quality improvement in health professional education seems not to be practical. Instead, it has turned to be an activity that is done, but no improvement is done in the education system. So I think as we plan to assess teaching, we need to know that it is important to do a quality improvement in the health professional education for better results. Curriculum change alone may not be enough. You earlier on mentioned that there are people who are doing teaching, but they are not professional teachers. This concept only can be addressed through that approach. And then the second issue is regarding the capacity building of the health professional education on short courses. I think over time, AfriHealth, for example, has done grants and given chance to its members and member countries to ensure that some people get this opportunity. But I got a feeling that these are not enough. There is need to scan more of the environment, especially in the health professional education environment, that enables those who are willing to transform these assessments for learning instead of assessment of learning among the students. Thank you.
Thank you very much, George. I think that is for noting, unless, Roy, you want to.
No, I think we can first have some other hands.
Yeah.
I also see Professor Els Chiguri. Ian, is that your hand still up or remnant one?
It's up again.
Okay. Ian, then Grazio, and then Elsie will come in also.
Yeah, one of the things that I find very interesting about faculty development and I challenge my colleagues about and challenge myself about, is that we teach the fact that, for example, didactic teaching, didactic education is not as effective as other forms of education, but we'll give a lecture about that. We will say that the best way for learning is, interaction and participation and involvement, but we will tell people that by giving a lecture. In other words, we don't practice what we preach. We do faculty development in a way that is completely not aligned with what we believe is the correct way to be teaching. We have whole conferences like the AME conference, for example, which is full of just didactic presentations, one after the other, no discussion. And that is supposed to be, the pinnacle of international health professions education. So I think we've got a huge disconnect that we need to think about in the way that we go about faculty development. Thanks.
Yeah, sure. Gracio, I hope I pronounce it correctly.
Good morning or good afternoon, everyone. From Mozambique, I'm a nurse and I'm also an educator. I'd like to share the experience of our country on this topic. And I'd like to say that I congratulate the presentations. I think this research brings a very deep reflection on the reality we are living in this topic of health professional education. There is a gap that must be addressed in African countries. So related to the governance, we have the National Directorate for the Training of Health Professionals that makes part of the Ministry of Health, that in conjunction with the National Authority for Professional Education related to all areas of professional education in Mozambique, implemented a reform of vocational education with a new model of curriculum based on qualifications. So this curriculum is really based on competencies, with elements of competencies, performance criteria, evidence of practice and learning as such. Evaluation has changed from quantitative to qualitative. So we are not giving numbers of marks, but we just refer if the learner or the trainer has achieved the competence or not, the specific competence. So another item is that the evaluation is no longer a secret of the teacher. So it involves the student, and it's also audited or passes from a peer review before being applied to see alignment with the learning objectives. So we have changed the identity of the relation of teacher and student. A teacher now is called a trainer, and the student is called a trained. So the challenge we are still facing is that all this reform today is seen only in medium level, so in the professional level. But for the universities, we still have this challenge. Most of the trainers are not keep it with competence for health professional education. You just have a master degree or doctoral degree, then you are a teacher. So this is the biggest gap. So for the medium level, all must pass from a specific train to be a health professional educator, and they must be certificated. And this is something that is running from the last 5 years. So I think movement in Africa, if we join our efforts, maybe we can really create a curriculum that can be shared among different regions to make a massive training of health professional educators. So thank you very much for your attention.
Okay, thank you. Definitely, we need to collaborate as a region to see where we can share good practice, best practices, and what we can learn from each other. Professor Elsie?
Thank you, Roy, for
Maybe,
the work.
maybe Elsie, you can also tackle the question of, do we need separate programs in health professions education to be developed, or integrate HPE into clinical practice? Thank you.
Okay. Thank you, Roy, and team, for the presentation and also for the work that you've put into this. Stuart, thank you so much for joining. He is also one of the people who really enlightened me a lot on health professions education. And it's good to have you here. So really, what Gracio talked about is music to my ears, because I really feel that this criteria for recruiting teachers or lecturers is distorted. Of course, we usually take the best, academically, and those are not the best teachers. But that is not something that is going to change quickly, because we know that universities, somebody has actually said to us that universities are like graveyards. They are so difficult to change. But I think there's been improvement in health professions education in our region. And for that, I've observed over the years that now more people are interested in improving health professions education and understanding what it is all about. And AfriHealth has also contributed a lot to this. So I would like to thank everybody who is involved in this. And about faculty development, with that background of how we are recruited into the training institution, we need, though there's been improvement, we need to do more. And most times when we talk about this, like today, I'm sure here we are talking to the converted, people who really feel that for someone to do justice to education, they must have some background knowledge on the basics, which I don't have to go through here. Because we know that all other teachers in most cases are trained teachers. But for us in health professions education, you are appointed and you are expected to train others without really having the background on how to train and do all these other things that we are supposed to. So to hear an institution or a country like, I don't know, Gracio, which country it is you are talking about, I believe that that is the way to go, that whoever is recruited to become a teacher or lecturer in health professions education institutions should be given at least some basic training, and we could have a curriculum whereby we can come up with a curriculum of just basics, and Ian, it would be good actually to do it the way we are supposed to do it, not through just giving them lectures, but to do some practice as well as we do this faculty development, so that we have everybody who is a trainer has some basic knowledge about how people learn, about how to assess, all those things that we would like them to have. But there are also other challenges which come up, like for promotion in most of our universities. There's still a lot of emphasis on research and publications, and not on how much health service delivery we are involved in, or how how much training we've done, or innovations in training, all those things that we do that are actually not looked at and promoted. So that because it is skewed towards the publications and research, is taken a lot away from improving health professions education. But us who are convinced about improving health professions education, we have to keep at it. And I like the way this webinar, this is really important. And we just we need to keep trying to convince more people that it is important. And I think over the years there's been improvement. A lot of work has been done through FEMA and, of course, and other organizations like FEMA. About the question that should the HPE be developed as a separate program in universities, or should it be integrated into clinical practice? I think it depends on the situation. If it is just beginning, this is my opinion. If it's just beginning, and I know some universities where even when you talk about health professions education as a profession, they don't even understand what you're talking about. I know this for a fact in Makerere, like maybe 25 years ago, there was nothing like that. If you are beginning, and there are a few pioneers that understand health professions education, it would be good to integrate it into clinical practice. Make sure that slowly by slowly you build capacity. And if capacity is built, and there are people that are interested in really developing it into a program of its own, then probably gradually that occurs. But to start it right from the start as a separate program may be difficult in universities. But if you started slowly, I think integrating it into clinical practice, then afterwards it could develop into a whole program. And that is the example I have is at Makerere University at the College of Health Sciences. There were a few pioneers who started this, who actually had undergone FEMA training and also had a master's in health professions education, and they were really convinced that this was important and started slowly by integrating it into clinical practice, talking about it, slowly by slowly, step by step, and later developing it into programs, a master's, and now PhD. So I think that would be useful. The issue also of health professions education units. About 25 years ago, still, there were hardly any health professions education units, or some people call them departments, others centers. But now, in fact, there's a paper we published, we could find only 4 to interview, like I think 15 years ago. And recently there's a paper I've put in the chat whereby we found that the numbers have improved. So there's been improvement in that, and we just have to do more and more work and find pioneers, find people that are interested in this to carry the work forward. Over. Thank you, Roy, for the opportunity.
Thank you very much.
I think Professor Menin wanted to add something on the units and departments of health HPE.
Hello, I want to, I am currently in Brazil. I'm speaking from Sao Paulo. I have been in Brazil for the last 22 years working in health professions education around the world and in Brazil. There's one thing that has not been mentioned. I want to follow LC's comments that faculty development is political, that we have not mentioned the political role of change in health professions education. So the question is, should you have a unit? Should you have a department? Should you have 1 or 2 or 3 people working and they work around? The model of power in your faculty, is it strongly departmental, top down, very hierarchical? In this situation, the history of the school recognizes departments and the power of departments. So you can institute a department of health professions education that's consistent with the infrastructure of the school. If this school is not strongly hierarchical, there's much more democratic and much more community oriented, then it would be better to have a unit of medical educators who diffuse their work throughout the institution in clinical departments and basic science departments. You do not need a department because it's not within the political structure of the school. So I think the question of whether to have a separate department or to have a few people working in the school and they work with everybody in different departments is political and depends on the history and infrastructure of the institution. Thank you.
Thank you very much, everyone. And can see our time is up. We can actually see that the debate was really heated, and I wish we had more time. And we believe that in future we can still have opportunity to continue with the discussion. Otherwise, on behalf of the East African region, we want to say thank you for everyone for making it to this webinar today, and more importantly to AfriHealth for making this arrangement, and to Dr. Roy for the facilitation. And so we are really thankful, and I wish everyone a nice evening. Thank you very much.
Thank you.
Bye.
Thank you, Priska, for moderating. Bye, everyone.
Thank
Bye,
you.
bye.
Thank you for the
Bye,
moderation. Thank you.
Thank you.
Bye.